Thank you very much for joining me for the latest episode of Between Sessions. I'm delighted to say that I'm joined by Gabrielle Puglia-Pesce today and really excited to hear her opinion on these key questions. So with that in mind, I'm going to jump straight into question one. Take me back to the moment that SLP became your path, Gabrielle. Was it a person, an experience, or something that you just can't explain?
Hi, David. Thank you so much for having me. I have a bit of a crazy story. So I'm a career changer. This is my third career. I was in television, I was in finance for almost a decade, and now I'm here. So, in finance, I was good at what I did, but I was basically a den mother and took care of everyone. And I really wanted to go into healthcare. My mom brought up speech therapy, and I said, I'd have to go back to get my prerequisites because my bachelor's degree was in something else. And then my grad school, I said it would be 7 years before I finished.
Yeah.
And I remember distinctly telling my mom I'd be 30, competing with young kids. And my mom said, you're going to be 30 anyway. So wouldn't you want to be 30 doing what you want to do? Yeah. And, it's not competing. It's plenty of room for everyone. So that's what I did. I went back. It did take me 7 years. And, I've been doing this now for about 6 years, and I couldn't be happier.
Amazing. It's great that you had somebody in your corner offering you that sort of guidance and advice to be able to go back and do it, because I think similar to you, I would have looked at it and thought, another 7 years I've got to invest before I can actually jump properly into the career. It's quite a daunting ask, isn't it? Especially when you'd already started to build a career. But thankfully, it's something you did. And I know from previous conversations that we've had that you absolutely love what you do as well. So it was definitely a worthwhile journey to go through.
Yeah, it was. She's given that pep talk to a few people who have also gone into the field they wanted to. So she's a good lady. We'll keep her.
Indeed, yeah, definitely. Wonderful. Thank you very much. And question two, and one that's really key and key for the series as well. I'm keen to get your view on this one. Strip away the challenges for a moment. On its very best days, what is it about the work that makes everything worth it?
I love this question, and I am really adamant about my answer. You will have so many victories that you never see. Like, these kids will go far and you won't know it. So everything you do does matter, even when it doesn't feel that way in the tiny moments. But for me, the things that make it worth it is, I have a student I met when he was 3 years old. He was completely nonverbal. I was his speech therapist during COVID, and I would come to his house because he couldn't attend. And now he's obviously older. He's 8, and I still keep in touch with his family. We're very close, and he is just leaps and bounds. He talks a lot. He goes to school. He's part of programs. He just won police chief for a day in his town and
Wow.
did that last week. Another kid, I was in grad school and we needed a student to do an evaluation. A mom reached out to me on Facebook. I said, sure. I had her son come in. We evaluated him. Again, I was in grad school, so that was pre-COVID. And now her son gets all of these specialized schools and programs, all because we gave him an evaluation in school and somebody gave them a chance. So, little things add up, and you don't really get to see that in the long run, but just know that it does matter.
Yeah, no, it definitely does. And amazing points, Gabrielle. I think in what is a challenging industry, don't get me wrong, I think we're all very aware. Anyone that spends any time in speech language pathology knows that it has its challenges. I think it's really important that people remember, like you've just mentioned there, those key things, that when you are in a day that's maybe a little bit more challenging than the previous or the next, it's important to remember the impact that you're having and the amazing stuff that's being done.
Exactly. Like, everybody expects a big wave of change, but even a tiny ripple still moves the ocean. So,
Definitely.
It's having to look at it at that scale.
Brilliant. And moving on to question 3, if you could change one thing about the speech language pathology profession in the US right now, something that you think would really, genuinely move the needle, what would it be?
I'm going to speak solely on the education point because, obviously with speech, there's so many different fields you can take. And, I have only been in the education standpoint for the majority of my career. And I think just in America right now, the education system is very longing. It definitely needs a little bit of an upheaval. And I think, with all of this demand for core curriculum and to get all the kids on the same exact playing field, it's very difficult for our neurodivergent kids, our culturally, diverse students, just anyone that doesn't fit the standardized box. Like all of our assessments when we assess students come from a very specific standardized group, that they base their standards off of, which are very typical, neurotypical students that maybe are not multi-speakers, multilingual, multicultural. So I think kind of just opening up the education system in general to look at students' individual help, and that will help everyone, because a class that has more accommodations, it's not going to hurt the kids that don't need them. It will just help make everything more accessible and help everyone thrive. And yes, it will help the kids that need it the most because it gives them access to the information, but it will also teach the typical kids empathy and, creative thinking, strategies, thinking outside of the box, being able to explain themselves more. So I think more access to more information, more accommodations, more strategies, and just really having more funding in the education system for all of these things that would move the needle.
Yeah, no, you're absolutely right. I think it would be incredibly impactful, and I really like the fact that you've brought up all the kids in a classroom as well, because some of the soft skills you mentioned there are arguably going to be as important, if not more so, when it comes to your career life than maybe understanding Pythagoras' theorem in mathematics. These are really key skills, and unfortunately, the curriculum doesn't really translate towards that in any way, shape or form, does it? So I think it would have huge impact on the neurodivergent population, but from what you're saying there, it would also have a big impact on all children within the schooling system.
Right. And even neurotypical students, I see there is an uptick, as we all know now, in 2026 with students with mental health issues or anxiety and testing anxiety and school anxiety. And these kids all have this demand to perform at the same level, and it has to be this higher level. And in school, they're just teaching them memorize and do. And what is that teaching them to go into the work field? It doesn't teach them, what they're good at, what they're passionate about. And, I think really just funding education better and maybe going back to some of those classes where they can learn like trades or, home ec, just things that they're good at, and more skills to bring them into the world, activities of daily living skills.
Yeah, no, absolutely. I completely agree. And moving on to our final question of today's session, Gabrielle, someone brilliant is sitting on the fence about speech language pathology, or maybe they're 6 months into the clinical fellowship, questioning everything daily. What do you want them to hear from you right now?
David, this is my favorite question, because the imposter syndrome of this field will kill you forever. Like, you will always feel like you're not smart enough, not doing enough. That will always be there. I've had mentors that have been in the field for 40 years that say the same thing. But grad school will kill you. I don't know why they purposely make grad school so hard and so disheartening. I guess to weed people out, but they do. Everyone's program is like that. They make you question everything. I had a supervisor. It's funny, I have two mentors from my grad school, and both of them, we had this like enemy to friend arc in grad school. And my clinical supervisor had sat me down and was like, you should quit this program. You're not made for speech therapy. Like, you're not good. And it was because I was a career changer and everyone else was coming from education. So their lesson plans looked exactly like, what the school wanted, and mine were different because I came from a different field and they were just different and I was still learning. But, we had since then, now she's one of my mentors, and she has said, she was just trying to purposely push me to show me that I can do more. And I love my field. I'm very good at it. In grad school, I constantly questioned it. And I think that you need to remind yourself that you're here for the kids and you're here to make a difference. Not in everyone's life. You're not going to change the whole world, but if you can change one person's world, maybe a parent whose child is neurodiverse and they're struggling, and you can give them either more information, or you can, you know, help ease them by giving their kids some strategies to use, or even a articulation student or a fluency student who's having difficulty expressing themselves. And, you know, it might be cute when your little 3-year-old is saying Paschetti, but when you're a 45-year-old and saying that, not so cute. So you're really, especially when you're in the grad school trenches, it's important to look at the big picture, because grad school will break your heart 10 ways to Sunday. But in the end, if you know that's what you want to do, it's so worth it.
Yeah. Amazing, amazing. Thank you so much, Gabrielle. Really insightful, really enjoyable listening to your views and opinions across the questions. So from my perspective, I just want to say thank you so much for getting involved and contributing to the series. I really appreciate it.
Of course. Thank you so much for having me. I really enjoyed these, and these were great questions to make me think about the field more.
Amazing, amazing. Thank you very much.